So what are the vaccine recommendations for transplant candidates and recipients? As you may have guessed, I'm going to be focusing on the bottom three, but just wanted to bring up the fact that you should also have your MMR, that's a live vaccine, so it's pre-transplant only, Tdap to protect you against tetanus, and pertussis, which is whooping cough, that's every 10 years. If you're over 50, like me, you should have your Shingrix vaccine to protect against shingles. We also recommend Prevnar 20. That's a once-in-a-lifetime vaccine, in addition to Pneumovax, hepatitis A and B, the HPV, human papillomavirus, if you're young, if you have a complement deficiency, asplenia, or plan to get a complement inhibitor such as eculizumab, the Haemophilus influenza and meningococcus vaccines are recommended. We also recommend COVID, influenza, and this just in, RSV vaccine if you are over 60 years old, or that should be considered. All right, so let's jump into COVID. I think it's always important to start talking about COVID with the reflection on the big impact it's really had, especially in transplant patients. This is just a review of many studies showing that if you look at folks who are hospitalized with COVID vaccine, looking at transplant patients, the majority are really kidney transplant recipients. Their hospitalization rate, intubation rate, and death rate are higher than non-transplant patients in many studies. And in addition to being admitted to the ICU, having COVID can damage your heart. It can cause kidney damage and chronic kidney disease. And changes in immunosuppression can impair your kidney allograft function. In addition, several other comorbidities in addition to transplantation have been found to be associated with poor outcomes, and those include increased age, end-stage renal disease, and diabetes, as well as obesity and lung disease. So COVID, unfortunately, remains a problem in California. I downloaded these slides from the state dashboard just today. You can see that new hospital admissions total 600,000 over the state, with a daily average of 277, an average of 18 deaths daily, and the positivity test rate is 7%. Now, we saw a nice little surge in August, end of August, early September, right when kids went back to school and when folks were coming back from vacations. Things are leveling off or declining just a little bit, but I'm confident that as the weather cools, it's easier for viruses to stay alive for longer on surfaces. And certainly as folks start getting together for winter holidays, such as Thanksgiving and Christmas, that these numbers are going to go up, way, way up. And that's exactly what we saw in 2022. So when we think about COVID in 2023, it's kind of like the good news, the bad news, or cup half full, cup half empty, depending on whether you're an optimistic or a pessimistic person. The good news is COVID in 2023, compared to, say, the terrible times of 2020, is that vaccination is widely available. COVID vaccination has been shown over and over again to be safe and to be effective in preventing severe disease and death, even in transplant recipients and even in patients on dialysis with end-stage renal disease. In addition, we do have treatments which are widely available, such as remdesivir and baricitinib, and these have been shown to have a positive impact on preventing death due to COVID. The other good news is that the newer variants seem to be less pathogenic than the original wild-type strain. Now, that's difficult to know for sure because certainly the population has more immunity, but I think overall it seems that these newer mutations seem to be causing less severe disease compared, again, with 2020. The bad news, however, is that many patients remain either unvaccinated or undervaccinated. The other bad news is that often treatment requires hospitalization, especially for transplant patients, and treatment is not 100% effective. So even though we have treatments, COVID definitely continues to cause significant morbidity and mortality in transplant patients, in older patients, and in patients with chronic medical conditions, including end-stage renal disease. And the other bad news is that these newer COVID variants, although their disease they're calling maybe a little bit milder, they're definitely more transmissible than the wild type strain. And so they're very easily spread from person to person. So just to look briefly at the story of the variant. So we started with the wild type. Then we quickly had the alpha strain that was back in 2020, followed by beta, gamma, and then delta is what caused the big wave in October 2020 and in the winter months of 2020, where we really saw high levels of COVID, hospital admissions, and death really worldwide. 2021 and really starting in 2022 is when we're really now in the era of Omicron only. And Omicron has become completely dominant over the entire world. Every virus that we sequence seems to be Omicron. So now we're talking about subvariants of Omicron that have these very awkward names that start with XBB. So the nomenclature started with this XBB.1.5. Then we had the 1.16. And the most recent strain that seems to be spreading is XBB 1.9.1. So these are variants that, only an epidemiologist could really love. But point being is that we've come quite a long way since the original wild type strains. And we're really in a COVID era right now. The good news, though, as mentioned, is that we do have vaccines. Pictured here are the bivalent vaccines. But what you really need to know is that since last month, September 2023, we have new vaccines that are specific, not just for Omicron, but for the XBB strains. And data shows that they are cross-reactive against the 3 most dominant variants that are currently circulating in the US and worldwide. Now, many of you, when I see patients in clinic, they tell me I had 3 vaccines, I had 4 vaccines. The reality is that now we're not counting. It doesn't matter how many vaccines you had in the past. What matters is, did you get the latest vaccine? That's all I'm interested in. So we've got the Moderna vaccine, we've got the Pfizer vaccine, and they're both available now with the new 2023-2024 variants. And if this sounds familiar to you, that's because this is exactly how we're doing flu vaccines. You don't tell me how many flu vaccines you've had. The point is you need to get the seasonal flu vaccine that's applicable to this season's viruses. Now, we really don't know for sure. This has been a rapidly, changing field over the past few years. But I think we're going to kind of get into a habit where every year or maybe as frequently as every 6 months, we're going to update our COVID vaccine and have a new vaccine available that is tuned to the variant that is circulating. Now, these Moderna and Pfizer vaccines, again, we've got 3 years of safety data. They're very well tolerated. They have minimal vaccine reactions such as arm pain, 24 hours of feeling unwell, sometimes with fever. They are both FDA approved. But if you're a person out there, for whatever reason, you prefer to go old school with a subunit vaccine, we do now have a subunit vaccine for 2023-2024 COVID called Novavax. That's a US company that's based, I believe, in Virginia. And it is now approved under a FDA EUA. So if you prefer to get a subunit vaccine, or maybe you had a bad reaction to an RNA vaccine, that is now available as of last month. So the recommendation is that if it's been more than 2 months since you got your last COVID vaccine, that you should get this new virus vaccine. And if you just had COVID and just recovered from COVID, we're recommending that folks wait about 2 or even 3 months from your last natural infection before you get the COVID vaccine. But even if you did just have COVID, it is essential to get that vaccination. Now, why? It's because the naturally occurring T cell and antibody response is going to wane over time, starting at about 3 or 4 months. Those antibody titers are going to go down. That's the perfect time to get a vaccine that's going to boost that natural infection response and keep you protected for many months after your natural vaccine. So good news, bad news. When we study hemodialysis patients and kidney transplantations versus healthy controls, we do see that if you're on hemodialysis, your antibody response is lower than a healthy person who doesn't have kidney disease. And if you're a transplant patient on immunosuppression, your antibody response is going to be lower still. However, when we look at T cell responses, they're actually pretty equivalent between folks on hemodialysis and healthy control. So that's good news. They are lower in kidney transplant patients. There's many publications out there about this. There is a non-response that's been observed to primary vaccination in kidney transplant recipients, but those vaccine responses are probably going to get better as more and more transplant patients who have survived COVID are going to be experiencing the vaccine not as a novel antigen, but as a booster. So it's not great news. If you're on hemodialysis, you're a transplant patient, your vaccine response is less than a so-called normal person. But the good news is that even with an impaired vaccine response, there's very strong data that vaccination can still decrease your chance of getting COVID, decrease your chance of getting severe COVID and requiring hospitalization and dying from COVID. And this is some data from early in the pandemic, but I like the visual abstract that they did. They show that if you were unvaccinated, your chance of mortality as a transplant patient was 12%. But if you had had 2 doses of the vaccine, and again, this is 2020, 2021, that mortality rate was decreased. And that has been shown in multiple studies. This one's from England. There's a study from UC San Diego that showed the same thing. And there's also data from folks who are on dialysis or with chronic kidney disease that even though the vaccine response may be tempered, may be attenuated, it still has a clinical impact that's associated with a lower risk of getting COVID, lower risk of hospitalization, lower risk of death. So when it comes to vaccination in folks with comorbidities, there's no question that half a loaf is better than none. So it's important to get that COVID vaccine.